Hi, my name is Doug Selinger. I'm the founder and CEO of Plex Research. And today I'm going to be showing you how to use Plex to analyze the hits from phenotypic screens. In this example, we're going to use a screen from GSK. This is an antimalarial screen. I've got here the SMILE strings from series 33. And I'm going to copy those SMILE strings and come over to Plex and just paste them in. And we see the 7 compounds go in. These are mapped all to the aliases because these are known compounds, but this also works for entirely novel compound structures. And I'm going to run the search. And so we're going to take this chemistry and map it to chemical space, and then map that chemical space to targets and pathways and all kinds of other data sources. And we're going to look to see, does this chemistry converge on any specific targets, pathways, diseases, et cetera. Well, we can see here from the target page, and you notice that we've got a lot of different data sources across the top that we're analyzing. I'm going to focus first on the target page here. This chemistry clearly converges on farnesyltransferases. Farnesyltransferase A is first. I can click on that result, and we can see that there's 100 lines of evidence that we're showing here connecting this chemistry to farnesyltransferases through a number of different analogs. So we were running these chemical similarity algorithms, which themselves are configurable. You can configure the fingerprints and the thresholds. And we've identified these analogs here, which are similar and which are farnesyltransferase inhibitors. And because we're showing all the structures, if you know something about the SAR, you can bring that information to bear, and also just look at the structures as a chemist and make an assessment about the similarity. So we've identified a lot of analogs of our molecules that are farnesyltransferase inhibitors. All the data points connecting them to farnesyltransferase are here. You can hover over these data points and it will show you the exact assay that was run. You can click on any of these data points and it brings you to the source of the data, which in this case is Kemble. And here there's a paper associated with it. So one more click and you're at the paper that generated that specific data point. So every data point is traceable back to its source. So the whole system is completely transparent, the chemistry and the activities. And so there's a lot of data connecting this to farnesyltransferase A and other related targets. In addition, here we know that these are antimalarials, so we can also bring that information in. We can ask, is there a way to connect this chemistry to malaria? And if we filter publications, for example, to malaria, we find that there's 7 papers that connect this chemistry to antimalarial activity. And in fact, a number of these go through farnesyltransferase activity. And if I click on this top hit, we can see that there's a number of analogs. Here we've got 24 lines of evidence. So there's a number of analogs of our molecules which are mentioned in this paper about farnesyltransferase activity as an antimalarial mechanism. And so we can do the same thing with patents. We find there's 4 patents connecting this chemistry to malaria. At least one of them connects specifically through farnesyltransferase activity. Again, you can click on these results and see the evidence connecting our chemistry to the chemistry mentioned in the patent. So there's already this pretty strong case for this chemistry being enriched for antimalarial activity, being enriched for farnesyltransferase inhibitors. In addition, we've got a lot more data here. So we can also look at other ways. And for example, if we look over in CRISPR screens, there's actually some data that we're picking up that is linking farnesyltransferase inhibition to sensitization to ferroptosis, which actually is a known mechanism, an antimalarial mechanism for dihydroartemisinin. And you see there's a number of screens where farnesyltransferase A was a hit. I can click on these and see how we get from our chemistry to related chemistry, again, to farnesyltransferase, and that's a hit. Farnesyltransferase is a hit in this CRISPR screen. And by clicking on that link, it brings me to the information about the CRISPR screen and the hit distribution and how the hits were called and what was screened and all the details. So really in this one analysis, we've gotten, just from one search, a high level of confidence in the putative target, farnesyltransferase A, both because of the pharmacology information and the strong link to antimalarial activity. And we also have a putative mechanism that is acting through ferroptosis because of the this CRISPR screening data linking farnesyltransferase A to ferroptosis sensitization. So if you're interested in learning more, please reach out. More information is on our website at plexresearch.com. Thank you very much for your time.